Frankel of Nebraska Medicine. You know, it's interesting. We all experienced a surge beginning last spring related to COVID, and we had to do a number of things to create capacity, including reducing and in some cases eliminating elective procedures. We had to move staff around, those who may have been working in the ambulatory environment, move them to the inpatient environment. And as the surge that we experienced in the spring began to wane and the number of COVID patients in our facilities decreased, our capacity did not drop commensurate with the drop in COVID patients. In fact, as we progressed throughout 2020 and into 2021, there are a number of individuals, as you can imagine, who deferred and or delayed necessary care because of the pandemic. As the number of COVID hospitalizations dropped, those beds became occupied by patients who had put off care or who deferred necessary care earlier. And so our system, as I believe all the others, have remained quite full and at or near capacity for many, many months now. We are having to retool our operational plans in response to the most recent surge related to the Delta variant. We are dusting off some of the operational plans and policies that we had in effect earlier this year and that had been developed early on in the pandemic to accommodate the surge we are seeing. And but as health systems, we've proven one thing, that we are able to manage from an operational standpoint. As Dr. Ward pointed out, we have worked collectively to share the burden of COVID patients. And we recognize that some institutions are able to provide certain types of care that others aren't. And we've been able to serve as a partner to our outstate community and critical access hospitals who have needed many of our tertiary and or quaternary services and been able to take those patients when it was appropriate to do so, in that we were able to offer necessary care to them that could not be provided otherwise. It's a challenge operationally, but we've got great people who have gained experience over time in being able to manage, and we feel confident that we will be able to manage going forward whatever the surge might present.
At Children's Hospital Medical Center, one of the things that we've seen is an increase over the last month or 6 weeks in what is normally called respiratory viruses, the winter respiratory viruses. We saw this actually happening in December and January in the Southern Hemisphere. And so we expected that it could happen in North America, and it has. It's not just unique to Omaha and Nebraska, it's across the country. As far as the COVID admissions though, we've consistently had less than 5. I think today it's 2. When the public health emergency was lifted, the ability to share data became much more difficult. And we're no mind sharing data. We're pretty full as well with other respiratory viruses, not with COVID. However, we do know that many places in the South states, Arkansas Children's Hospital, in Texas, in Louisiana, in Florida, they are filling up with COVID patients. They're having COVID admissions like they've never seen before. And we anticipate that will happen if we don't employ the non-pharmaceutical interventions such as masking and social distancing, keeping our hands clean. That's what's going to be important in order to limit the spread of this crazy Delta variant.
I would add in that we are running very full 97, 98% capacity with medical patients, surgical patients. The ICUs are full as of this morning. We have 3 ICU beds open. So yes, we're worried about having to accommodate a surge.
Doctors, could you talk a little bit about, you mentioned this, Dr. Maloney, a little bit, but we're hearing from doctors, and obviously social media always amplifies this, that med surg and step down beds for children, pediatric beds, are really hard to come by in Nebraska right now. And this with kids just starting back to school and with this Delta variant. What are you seeing in the last week or so? And how realistic is what's being spread that folks are being turned away, that sort of thing?
Well, as I've mentioned, we have had an increase in the winter viruses, respiratory syncytial virus, or RSV, being the most common that we see. And what's great about our organization is that at the end of the month, we get to open our Hubbard Center for Children. So we're going to increase by 80 beds. Now, with that being said, it's still a staffing issue. We work with all of the hospitals in our area, as well as others outside of our area, to find locations where we can hospitalize patients, working very closely with Nebraska Medicine, with Bergen Mercy, in order to transfer for patients as they're needed if we're getting full. So we still have beds. We really don't want to surge in COVID, that's for sure.
In the statement, it was mentioned that each system will have a policy for exemptions and employees wishing to be granted a waiver. Wonder if you could expand a little bit about the requirements on those. Maybe Dr. Doran, we can start with you, and Dr. Ward chime in as well.
Yeah, I think each institution is going to develop their internal policies on how to look at exemptions and then what the consequences might be for that. I think some of those policies are yet to be determined and yet in development, but ultimately there will be some sort of either restriction on how someone can move about the hospital, or whether there might be testing, or, I mean, all those things are being considered at various places right now.
Yeah, I don't have a lot to add to what Dr. Doran said. We are all getting into the details of those right now, working with our ethicists, legal, other hospital systems to determine exactly what qualifies for the religious and medical exemptions. They'll be very similar to our current exemptions we have for the flu vaccine, which many of us have mandated for, close to 10 years.
Doctors, if I may, Nathan Grieve, Channel 8. I have a question somewhat related to that. Is there at least early in this process, is there any indication of whether or not this is going to be a hard or a soft deadline? That is to say, is there going to be a requirement that the vaccination needs to be completed, or is the requirement mainly looking at whether a vaccination is planned?
For CHI Health, I'll say real quickly, our plan is to have all of our leaders vaccinated, fully vaccinated by October 1st, and all of our employees fully vaccinated by November 1st. And that's planning on that's going to be a firm date.
I would agree with Carrie in that, and that's one of the reasons that the deadline for vaccination for our employees will be November 1st. That allows them time to get both doses if they're getting one of the 2-shot vaccines.
And at Nebraska Medicine, our deadlines are October 1st for our leaders and October 8th for everybody else.
At Children's, we have the date of October 18th for leaders and November 1st for everyone else.
At Madonna, we're still working through our process and deadlines there, but very likely a November date.
November 1st for our hospital.
Another question that was submitted by Nathan, asking why this decision is being made now rather than earlier in the vaccination process when community rates were lower.
So I'll lead that one off from Children. So as you heard, we've been talking as CMOs a long time, and we started talking about this requiring of vaccinations probably in May. And the idea was, well, when it's FDA approved, we'll feel much better about requiring. As the summer has drawn on and the approval from the FDA is moving in now to September, it was previously, we thought in August, we came together with the CEOs on July 30th, and all of us agreed that waiting isn't going to help our community. And therefore we waited as long as we could. And now we're going together with the vaccination.
We also see what's happening in the South, and we're running a little bit behind them in terms of starting a new surge. So we think this is the ideal time